This is our webinar. This has been planned for months in advance. So we're going to talk more in depth about our toolkit that was a labor of love that was put together over the last year and a half with NHRC, with Lighthouse Learning Collective, and with Trans Equity Consulting. And I'm joined here today with Ari and Matteo. First, just to introduce myself very briefly, because it's going to circle back. Thank you, Viento. I do talk way too fast, so I appreciate the reminder. So I oversee the Lighthouse Learning Collective, which is out of New York City. It's a program for trans and queer people who use drugs, who engage in sex work, and we look at those intersections. We meet monthly. So if that's something you're interested in coming and participating in, you can email us at lighthouse@harmreduction.org. We also are planning our third edition of our Lighthouse Learning Series, which let me know in the chat if you've been to any one of those learning series sessions, because we've done a ton of sessions. You can actually go on our YouTube. You can check out Queer History of Harm Reduction. Sex Work 101 is on there as well. And also, if you go to harmreduction.org, you'll find tons of publications and resources. So yeah, we'd love for you to check it out. So Ari, I'm going to pass it on to you.
Hi everyone, my name is Ari Jauregui, pronouns they, them. I'm Peruvian, I'm based in Cusco, and I work with Trans Equity. I'm a consultant and social researcher for everything trans related. And this toolkit was made with a lot of love. Yeah, so we're happy to have you here. Thank you.
Hey y'all, my name is Mateo Belen. My pronouns are he, him. Really, really grateful to be here with you all. And I work with Adi at Trans Equity Consulting. And this has been a labor of love that we started with Cecilia, and we're so grateful to be able to be sharing it with you all now and really excited for this conversation.
Thank you both. You're actually brief. I say I'm going to be brief and I'm never brief. That's just like the nature of it. One thing I did forget to mention is that although we have the chat active, because I love getting all the tea and seeing how people are reacting in real time, love it. I would also love it if folks direct any dedicated questions in the little Q&A feature. We do have probably about the last 10 minutes of this webinar reserved for questions. However, because we want to make sure we're interacting with all of you, if your question comes up and it fits kind of with what we're talking about in the certain time frame, we will answer it. That goes for myself, it goes for Ari, it goes for Matteo. So we're gonna go ahead and dive in. All right. So today what we're gonna cover, I'm gonna take us into the why. How did we get here? Why did we spend so much time doing this? How did we get here? What's going on? What is our hope for people? I'm gonna take us a little bit into the history, and I'm gonna pass it off to Ari to talk about safety. Matteo is gonna talk about the healthcare section. And then also we're going to go into next steps. And Amber, I am seeing, I know you're spotlit, but for some reason, someone's saying the ASL interpreter is no longer visible on the screen. So I'm not sure what the issue is. I see you spotlit. And Aiden, it's okay. There's no form. There's actually a survey at the end. So once you exit the webinar, it'll prompt you with a survey with just some questions we have, but I appreciate the question. All right. And so largely, I'm not going to be doing this slide based. If you have, okay, Andrea, thank you for that. If you have visited our website, if you've, checked out any of our social media posts, you'll notice that the toolkit was actually created as a web-based tool. So we thought what better way than to actually walk through it with all of you. So that's what we're going to be doing. So just for our folks, so we're all on the same page. So the why, this is a quote what's in the black on the right there, this is a quote that I put in a lot of my trainings because many times when I'm working with frontline staff, they'll say, "This sounds really good, but I can't do anything about this because my leadership, supervisors, managers, they don't really think it's worth the investment or worth the time." Right? So to read it out loud, it says, "Affirming outcomes are only as successful as the extent to which leadership buys into the interventions needed to produce them." That's a really wordy way of saying people need to give a crap to be able to do the work. And it's what I like to call accountability. So this toolkit was something that I had had in mind as the program manager for almost the last 3 years, because in providing the capacity building, so the training, the TA to the social service providers and largely the harm reduction programs in New York City, I was finding that there was a major gap in the understanding and in the service provision for people who are queer and trans and using drugs and doing sex work. And that's also why my entire position was created in the first place, because you have harm reduction organizations doing their thing, right, and doing it well, but not fully understanding and embracing TGNCNB folks, right? And then on the other hand, you have LGBTQIA service providers doing their thing, doing it well, but not really understanding the foundations and the principles of harm reduction. So it was a way to kind of merge the both of them and braid it into our larger harm reduction movement. Um, so again, just here in Spanish for folks, just so it's accessible and we're more on the same page. Because a lot of times at the end of trainings, staff would come up and say, "Okay, now we want a session on chemsex. Maybe we want a session on how can we increase our ability to take an appropriate sexual health history," or "Our intakes are really long because our funders are designating it and saying that we need to have 30 plus pages in here to be able to capture a lot of information," which I get it. We're beholden to our funders, but at the same time, there is a better way to do things. So that's what we were trying to do here. So I just wanted to shout out, as Mateo said, the late, great, legendary immigrant, trans woman, sex worker. She held so many titles and so many identities. It's literally impossible to try to sum up anything about her life without her actually being here. But she really was the heart of the project. And we unfortunately lost her about halfway through. So we thought, what better way than to dedicate the toolkit to Cecilia? So we very much just want to pay homage and honor her memory. And we hope that this toolkit will continue to give time and time again, right? So I am going to bounce it over. Da-da-da-da. Just let me know in the chat. Is everybody still able to see this? Can you see me scrolling on the screen? Scrolling. Awesome. So Amian, I mean, I could send you the Canva link for those. I mean, it was just a little bit of info, but really where we're going to spend the majority of our time is on the web-based version. So there is a PDF version. If one of my coworkers wants to put any of the bit.ly links in the chat, that'd be great just to help me out. So this is what you'll see. It's actually built as a Canva site. And it's pretty easy to navigate. I would say though, on the mobile, it's maybe not as accessible. That's why we created a PDF version of it. But what's great is that you can actually click on any one of these and it'll jump you to that section. So if you're like, all right, I'm looking for a specific section, I want to go and look at gender affirming hormone therapy, I'm going to click there. Maybe I want to look at non-traditional economies, which is talking about sex work. I'm going to go there. And there's also, of course, the link if you wanted to view it as a PDF. We got you right there. So the history of this is probably the place where I spent personally the most amount of time. But I'm getting too excited. I'm getting ahead of myself because one of the things I wanted to walk through was we spend a lot of time telling you how to use the toolkit, right? This is not a toolkit. This is not something that we think you're going to sit down and read 100 pages and read the whole thing in at one sitting. It's just not possible, right? So this was meant to be pieced up. There are animations in it, right? There are those section headers for you to explore, right? So the accountability piece, which I know I just did an intro on, very interested in, um, is this self-assessment, right? So we're assessing our own knowledge and our own ability, but at the end, there's also an organizational assessment that's a one-pager that I would encourage you to download and talk about with your groups, with your organizations, and actually goes into what are our policies? How are we engaging, collaborating with groups? Right? What are our clinical procedures and protocols? So just an idea here of what we're covering, right? So it just kind of preempts you a little bit with we're going to talk about sexual health. We're going to talk about overdose prevention and response, which some people might think, well, why am I going to talk about this in a training specific to queer and trans people? But we can't always assume that we know everything all the time. And to help us with the self-assessment, right, our own learning as we explore the toolkit is the scoring rubric. So you'll actually have points, right, corresponding with questions. So each question is 2 points. And you'll see here it breaks down with all of those sections that were listed above. And then we let you know, hey, if you didn't score so hot, maybe you scored, I don't know, 6 points, right? There are a lot of opportunities for you to explore, increase your learning, right, and your harm reduction practice pertaining to queer and trans people. So I love that part. And then we give you next steps, right? What are the things you're going to do? Are you going to seek more training? Or are you going to collaborate more with your colleagues, right? Are you going to seek out the certain areas that you didn't maybe score so hot on and revisit the toolkit? So all of those pieces make up that self-assessment. And then, so with the history here, we felt like we couldn't really get into the toolkit and talking about things like chemsex and sex work and specific substances, like fentanyl or xylazine or even sexual health without talking about why all of this is important. So we wanted to provide a very short history of gender affirming care, which I'm obviously not going to read through now, but it walks you through, how did we get here? How did we get to present day where we have over 600 anti-trans pieces of legislation, right? The worst year on record, and many of them getting passed, relating to things like medical care, relating to things like sports, book bans, all of these things matter and they impact our overall well-being and how we move through the world. So it was just a way to provide people who are maybe not as familiar with the landscape, right? How did we get to current day backlash, which I would argue is part of the larger struggle, right? And battle for overall bodily autonomy, right? Nobody should be telling you what you need to do with your body in the way that feels good to you and for you. So when we talk about things not only like gender affirming care, but drug use, sex work, reproductive health, right? All of these things, in my opinion, scale back to this concept of bodily autonomy. And then it actually walks you into, all right, so where are we now? Where are we going with this? And since this was written largely last year in 2023 and wrapped up in the early part of 2024, I caution people with some of the links or data might be outdated by now. We've done our best to write things in a way that's comprehensive, but we pull out specific things, right? The fact that a lot of trans people, I myself have met probably a dozen in the last year who have moved from very restrictive states up to Connecticut and New York, right? Just to be able to access care and the things that they actually need. And then we land on this, okay, I get it. The history is great, but what does it actually have to do with gender affirming care? And that's the piece that I just, got on my pedestal and talked about with regard to bodily autonomy and how central it is to both harm reduction and affirming care, right? And then we give examples to folks. So it's uplifting communities. It's addressing those specific health challenges beyond just talking about HIV, right? The amount of spaces and trainings I'm in where people are not talking about Hep C, they're not talking about hepatitis A, right? They're not talking about these things that are very specific, even MPOX, how all of these things impact our communities, but they're maybe not getting recognized as much. They're not getting as much funding, right? All of these things are really integral to providing the support. So I am going to pass it off just for the sake of time. I'm going to pass it off to Ari to get us into the safety section, but I will invite folks to, take a deeper look at what drug use looks like in our communities now, because what you will find is there's a real scarcity of that data. So for any researchers out there, collaborate with one another, get the data. But all right, Ari, I'm going to let you take it away.
Thank you, Taylor. Okay, so the first big section we have is the safety section. There we have a lot of chapters that are just related to trans specific just practices and experiences. So the first chapter we have is the chemsex one. Here, what I really like about this section is that it has some highlights with definitions. It also includes videos. If I don't know, maybe you don't want to read the whole thing, but you might wanna, watch a short video with animations that has basically the same information but in a different format. That might be also very useful, not just for someone that's a provider, but also for trans communities. This might be more accessible for us. So here we also highlight about buffing, something specific that might happen in chemsex, but also in other settings. And we always have, as a description and then some recommendations on how to make it, to have a safer experience. It's never don't do this, or this is risky, or this is gonna, cause harm or anything. It's like, okay, how can you make this experience better and safer? Yeah, so more some aftercare when it comes to buffing, and then what happens during chemsex, more. um how some chemsex encounters are arranged. Even some emojis people use to describe or signal that they might be into chemsex in some apps, like dating apps or hooking up apps. And I also really like about this section that it breaks down tips into specific moments of chemsex. So if you like, yeah, more. Yeah, so you have specific tips that are actually very doable. What you can do before chemsex, stuff like just have a phone charger, or make sure you're researching about some drugs and what interactions they have with, I don't know, HIV meds, or even your just any other meds that you're taking. Then during chemsex, what can you do? Um, eat or drink water, because drugs sometimes make you forget that you're hungry or even thirsty. And then what can you do after, about how to manage a calm down? Because if you are spending a lot of days or hours doing specific substances, then you need to find a place where you can, be safe and just relax after that experience. So it's always about how to make this a more enjoyable experience and keeping you safer. Then we have another chapter about silicone injections that, it's a practice that a lot of trans people use to modify their bodies, or to plump some parts of their bodies. And there's a lot of evidence saying that actually silicone in the body can have some negative impacts, not like health impacts, but we we want to focus on, okay, what are some alternatives you have to silicone injections? And if you decide to do them, how can you be safer in that process? So here you'll find also some resources. If you're a provider, like you wouldn't want to tell someone, just okay, like don't get the silicone injections because they they might still want to do them. And there's a lot of reasons that we actually list here why trans people actually get silicone injections. When it comes to, just having an accessible gender affirming procedure, the cost of silicone injections, there are a lot of reasons why trans people might still want to get silicone injections. So you have to meet people where they're at, so we do list some alternatives to the injections, and at the end, we also list some ways to make the injections safer. Yeah, some like recommendations. Okay, and then we have a chapter. This is actually the longest chapter in the whole toolkit. It's about overdose response and prevention. So it's very comprehensive. And if you are a service provider, you might have this information, but this is especially important for trans communities. So if you are a provider and you already have this information, you can also use the toolkit to share with trans communities, or if you're doing like a training, this is actually a very great resource. And we're working, date to be announced, but we're working on a scene that covers a lot of these points that are, in a different language that's more accessible for trans communities, and it summarizes just like the key points in the whole toolkit. And this is going to be like a big part of that scene. Okay, so here we cover some of the drugs that people use, like opioids, things like, fentanyl, and how right now a lot of drugs are fentanyl laced, without people knowing, I mean, without people having the intention of using fentanyl. Yeah, we also have a chapter about depressants, alcohol, benzos. Uh, right now, a really big thing is xylazine or tranq. And also, a lot of people might not know that their drugs right now have xylazine in them. So we have a lot of recommendations on how to prevent, um, you know, or just give people the information for them to know what is in their substances. A chapter on G, and that's also used a lot during chemsex, but also like in parties and other settings. We have a chapter on stimulants. Here we talk a lot about crystal. And as you can see, like we list some of the risks associated with the use of the drug that we are like highlighting. But it's never just that. We also include tips for safer use. I mean, we want people to have all of the information, not just like the reasons why, oh, you shouldn't do this drug. And then this is a very important section because we also have a lot of tips for preventing an overdose. So things like try to not use alone. I mean, have someone with you, or even there are a lot of apps or hotlines that you can call to just reach out to someone when you're using alone. So if you become non-responsive, they can like have an emergency plan to get help, using test strips, which is something really amazing that exists, and that is also very accessible. You can like mix your substance and know if it has fentanyl or xylazine. And here we have a step-by-step guide on how to use those test strips. We also have a video if that's, easier for you. And then we have a section about how to spot an overdose. So, of course, the symptoms vary depending on what drug you were using. So, an overdose on opioids, depressants, or stimulants is going to look very different. So, at the end of this chapter, we also have a section on how to take action depending on the drug. We also include some first aid, just like basic tips, including how to put someone in the recovery position so they don't choke, how to provide rescue breathing, at least the basics of it, because we know you might need like specific training for that. And then we have, a section about calling emergency services, which for trans people, especially trans people that do sex work or that are HIV positive, or just, trans people of color in general, calling an ambulance or the police might be just a really intense and scary experience because of police harassment. So just some considerations you can have when just calling emergency services. And this is the section when we teach how to respond to an overdose. It has a section on naloxone, how to use, the nasal spray. The injectable version is also available in some parts of the country, but people might usually in a party people have the nasal spray. And we also highlight that it's very important to use it even if you don't know if the person used opioids, because naloxone, acts to prevent or to reverse opioid overdose, but you might not know if the person had, like fentanyl in another thing that they were using. So it's always, to be safe, like it's always a good practice to use it if you notice someone is having an overdose. Yeah, and there's also a video you can look on, the step by step. And then we break it down on different kinds of drugs. And that's the whole overdose section. Yeah, some of the symptoms. And we also have a lot of resources. If you're in NYC specifically, there's a lot of services, organizations that provide test strips, drug check-in services, even nasal sprays and training. So here you can like contact them or just go to their socials and see what they're doing. And these are the hotlines and apps that you can use if you're using alone. So you can just like download them and send an anonymous message saying, hey, just in case like I'm using this drug, I'm by myself, and this is my emergency plan if I become non-responsive. So that's a really great resource. And I'm gonna pass it to Mateo to talk about this section. Thank you.
Thank you. Um, Before I go into this section, I want to name one other amazing resource that's in the document that is self-reflection questions, which is at the end, that I think goes back to Taylor's point at the beginning about how to really use the toolkit, because there is so much information. One way that could be helpful in figuring out like, am I taking in, am I understanding what's coming up, is being able to look at those self-reflection questions as you are reading through the different sections. And so you could take a look at them either before you read the section or after, just to see like, what did I take away? Oh, I like, maybe I don't fully understand this and I need to go back. So I just wanted to flag that before going on. And so non-traditional economies are things that are super important for us to talk about when we're talking about TGNCNB communities. And it the economies are basically things that are happening underneath the table, quote unquote. So that can mean sex work, that can mean selling drugs, that can mean a lot of different things. And in this section, again, to Ari's point, there are the call out boxes that will describe things and define different things. And then there are videos that go throughout for folks who are different learners. You can keep scrolling. And so there's a lot of data about unemployment. Sorry, there's data about unemployment rates and the reasons why our communities may engage in underground economies. We're calling it that, but we also want to be clear that just because they're quote unquote underground doesn't mean that they are negative or bad. They're just things that are not necessarily talked about or spoken about as frequently. And we also want to just be really explicit and clear that even though we are talking about the overlap of TGNCNB folks who are sex workers, not all TGNCNB folks are sex workers, right? We don't want to conflate those things. And so we want to make sure that we're checking our biases. And we know that there's a continuum of sex work, right? There's folks who are giving full consent. There are circumstances, which means that maybe somebody is engaging in sex work because of specific certain circumstances that they find themselves in, but would not otherwise want to engage in sex work. And then there's coercion. We want to be really explicit that coercion is not sex work. Right? That's actually sex trafficking. And oftentimes those two things get conflated, and we want to really tease that out and make sure that we're not doing that. And we're talking about this because we know that there's the compounded correlation of discrimination and criminalization, right, which increases our community's health risks, our willingness to engage in going to medical providers, which we're going to talk about in a little bit, but also the increase in incarceration and what does that actually look like and the devastating impacts on our community. We know that this looks really different than it used to in New York from the walking while trans laws, which used to mean that folks would get arrested if they had more than 3 condoms in their pocket. And so that's part of why we're having this conversation. And you can keep scrolling. And here are some of those self-reflection questions. And so now we're going to get into a conversation about healthcare. While the conversation is going to start with sexual health history, we want to be clear as providers that sexual health isn't the only healthcare issue that trans folks have. And so we want to be really thoughtful about when we're asking people questions. We know, to Taylor's point earlier, that there are so many laws that are seeking to criminalize our ability to access healthcare. And so what that means, both present day and historically, is that folks may be super on guard when coming in for services. There may be anxiety about how you're going to ask them questions or how you're going to treat them. And so what we'll see in this section is a lot of advice and ways to ask questions differently, to use the language that people are using for their own bodies, asking people what language they use for their body before saying the words that you think you should be saying, which is super important. You can keep going. And so while oftentimes conversations around trans health is overly reflected in HIV services, we want to be clear that there are other health risks that our community faces, whether that is Hep C, but also the compounding of mental health and all of the other things. So it's not just related to sexual health. And I think, Taylor, if you scroll down more, some of the other advice that we give both connects to obtaining sexual health history, but also just in general, how you can have more trans inclusive documents, whether that is documents that are up in the space or intake forms that allow folks to tell you exactly who they are and the language that they want you to use for them. This is particularly important for folks who have not been able to access being able to change their legal name. And so making sure that your records reflect the name that the person is telling you they want to use and not using their legal name, particularly in open spaces. And so much of this is making sure that you all are educating yourselves because it's not your patient's responsibility to teach you how you should be providing services for them, though we often know that that is the case. We also want to just like remind folks that trans folks have a diverse and unique experience, and so you can't lump us all into one bucket. Just want to flag that, and then you can keep going. We talked about the patient forms a little. The body map is really wonderful because you can let folks write in on a body map the language that they want to use for those different body parts so that that you can then reflect that back. Sexual health history, again, asking affirming questions. You see a bunch of those here. And then we give some practice about how you can navigate uncomfortable situations with patients, which is super helpful. So this is a space I'd recommend going to if you are a medical provider or you are somebody who does any medical related situations with folks. And you can keep scrolling, Taylor. And then we have gender affirming hormone therapy. Part of this section is really a smaller conversation from the larger toolkit that you can connect to from here, navigating access to gender affirming hormone therapy. To Taylor's point earlier, this is super important because we can't really tease it apart, but also wanting to remind folks that there's a lot of different ways that folks are told like what you can expect and what you can't expect from gender affirming therapy, and we know that it's actually really different for everybody. But you can keep scrolling, Taylor. And so these are the different types of medications we go through. Talk about the different ways that folks can use those medications. Information that should be considered for folks in regards to time frame, regular monitoring, and then going back to safer injections, right? Like how you can actually do this in a safe way, making sure we're using new needles, etc. Keep going, looking at the time. Yeah. And then here are those self-reflection questions I was mentioning earlier. And Taylor, do I pass this back to you or do we give space for folks to ask questions?
All right. Yeah, you can definitely pass it off to me. Thank you so much, Mateo. I'm just trying to get my video back on here. But so this part right here, this organizational readiness checklist, I talked a little bit about it in the beginning. So basically, this is kind of, I guess, the final part of the assessment. I don't really know if I love that phrasing because in the beginning, we're talking about a self-assessment and this is for the larger body, the organization, right? So this is something that is independent of, but also works in concert with that self-assessment because we wanted to provide a way for organizations to really look critically and think critically about the services they're providing and the things they're not providing, right? It's not to bring a sense of shame, but it's to hold folks accountable. A lot of organizations they get lots and lots and lots of money to provide services to trans and queer people, but are not actually providing the services that we need or the services that we're asking for. So just to sum it up, so we can get to any questions and things, I do want to let folks know there's a really large glossary. So it goes into many of the terms that we had mentioned here in this webinar that are all mentioned throughout. We thought it was great to include because not everybody is going to be coming to this work at the same level, right? And also when we are translating this document, which I think I saw a question there in the chat about, which we're excited for the zine, but also, yes, our hope is to translate and take this document, this giant document that actually was much longer and we trimmed it back because we were like, who's going to sit there and read all of this? It almost was like a novel at some point. We just wanted to make sure to ground and that we have the same understanding of these terms as we walk throughout the toolkit. So there are a lot of them, which is why it's not included in the PDF version. And we have a small note saying, if you want to look at the glossary, you want to look at the exhaustive list of resources and things like I'm going to show you here, come to the web-based version because there are tons and tons of resources here. So I am going to stop sharing my screen just so I can come back with you all. Um, I see there was one question in the Q&A. I don't know if Ari or Mateo, you want to mention this, or Ari, because it's in the safety section, but somebody said, I'm wondering if within the section about safety and support, are there links or considerations for people to contact that are alternatives to police intervention when experiencing overdose? Just thinking about the complex relationship between police and TGNC folks' safety. So we got a nice juicy question there. Oh, there you are, Ari.
Yeah. Um, Thank you for that question because that's actually very important to talk about. Um, so one of the recommendations we have is that I mean, you should call like an ambulance or if a person is having an overdose because you might not be able to actually address all of the, health implications of having an overdose, even if you have training or if you have, just like a nasal spray or yeah. And some health complications might be long term. So, I mean, it's recommended that you seek medical care at some point. But the thing is, when you call 911, you don't need to say that the person is having an overdose. You can just say that the person is non-responsive. If you say that they're having an overdose, that would, you know, um, like flash that drugs are involved, so the police can, I mean, it might want to be there. So if you just say the person is non-responsive, the police might not show up. Um, Also, I think there are some organizations, and maybe Taylor knows a little bit more about this, but some organizations can provide that, medical care that the person needs at that moment. Um, Also, some recommendations when responding to an overdose might not include calling emergency services. You can actually like have a plan with the person that's using drugs. Like, hey, if something happens, do you want me to call an ambulance? Like consent is also very important in that scenario. And of course, you need to obtain it before the situation happens because the person might not be able to give consent at that point. Um, so some people might say, hey, my roommate can take care of me, or this family member, or my significant other. Um, so that's also another recommendation, just to have a plan with them. Yeah, but it's hard to have the police involved in that situation, even if there are laws that protect people that um, actually call to report an overdose. You can be charged, actually. There's the Good Samaritan law, which, yeah, maybe you can like do a little research about that, what are the limitations of that law. We have some, like bullet points on that on the toolkit. Yeah, I hope that responds to your question. It's definitely a complicated issue, because we want the person to receive care, but also we don't want to put them in a situation that is going to cause more harm, and the police actually probably is going to cause more harm at the, long run. So yeah, let me know.
Thank you so much for that, Ari. I'm just going back to the chat here. Yeah, someone's putting in a resource link that showcases alternatives to calling the police. They break it down by city and state. Um, and that's why, as Ari put it, we're really careful because although this toolkit was created with NYC, New York folks in mind, we knew that you all and other states were going to access it. So we put a link there for folks, Good Samaritan laws in other states, because, if somebody has an open warrant, if somebody has a case with Child Protective Services, they have a felony, this is not going to protect them. right? And also thinking about public housing programs that many of them have a really strict no drug use policy, it's going to make it very tricky. The short answer of all of that is no, we did not put a specific section with these hotlines or warm lines, what have you, on there. I do think I love that recommendation because I currently am looking at a non-carceral resource list that I just put in our Lighthouse agenda. And many of these lines we can add to the resource list. I think the struggle, not to sneak out of the answer, but I think the struggle was this section was our longest section, and we had probably about 20, 30 pages more of content. And at some point, we had to cut it. Not, of course, because it's not important and it's not something that we're not thinking about, but I think because of the complexity of mental health, drug use, violence, discrimination, safety, we want to make sure to do a little more than just writing a paragraph or two on it, right? Because that's a field that some folks devote their entire career to. So maybe I foresee another zine, Ari and Mateo. I don't know. We can work it out. Um, but we just wanted to provide folks with an overview of people who maybe are not sure of what the law is actually covering at this given moment. And what we did is we shifted our focus to the sex work section of really making sure, since I personally feel like sex workers get talked over and they get forgotten about, unjustly so. So we wanted to do a lot more in that section to actually tease out this conflation with trafficking and consensual sex work. So hopefully that did answer it. And thank you, Ari. All right, we've got about 5 minutes left. Does anybody have other questions, other things they're curious about with the toolkit? Also, yes, this is being recorded. It'll be up on our YouTube, I would say in probably a couple of weeks, just because we have to edit it and make sure it looks all nice and pretty. That'll be up on HRC_Lighthouse on YouTube. We'll have it there. So everybody that registered today, all 300 some odd folks, will get a copy and we'll get a link to it. Yeah. All right, going back here. All right. So final call for questions. Anything else? I see a lot of folks sharing resources and knowledge, which I definitely encourage and I appreciate you all doing. And what I'm doing is I'm actually saving the chat. So when I have the follow-up email, I'll make sure to include these resources since we have folks joining from all over. I'm not sure, how many states are represented, but it's a lot. Perfect. So Ari, Mateo, do you have any last words, any words of wisdom for the group?
Just appreciate y'all so much. And Ari, do you want to talk about the zine a little bit? Okay.
Sure. So this toolkit was intended just to give information to service providers, specifically people that work in syringe programs. However, we just had so much valuable information that we wanted to give to the trans community as well that, I mean, might, but probably is not gonna sit down and read like a 100-page PDF document. So we wanted to create an alternative to, distribute information in a way that's more visual and manageable and just in a different language. So we're partnering with Body Hack actually, which is a trans party that happens in NYC. To create this resource that can be distributed in their parties and in other settings as well. So we have sections, a very like summarized version of the toolkit, and it especially has information on how to respond to an overdose. So in nightlife settings, people might be using drugs. So to have like a little scene that you can have in your pocket, in your purse, in your wallet, even, um, to know what to do at that moment, instead of opening a 100-page PDF document to read what you can do. Like that, we thought that was very useful, and that scene's gonna be in English and Spanish. Um, so yeah, we're excited. We're working on that, and we'll let you know when that's ready and share that resource. Yeah.
Awesome. Thank you for that, Ari. So clearly a lot of exciting work, more to come. This is such a juicy project. I did see a question in there about resources. Oh, okay. So somebody asked how they can access supplies, medical supplies, harm reduction supplies in Chile. And I do not know. I'll be the first one to tell you I do not know. If we have some folks in the room who are aware, who know, please share. What I can do is take that back and follow up with you, Bastian. If you want to provide your email, I know I have it in registration, but just in case, more than likely can try to connect you with somebody. Yeah, and the other question, I know we're almost at time, is regarding HRT and needles and things. Highly suggest visiting the guide that I linked. We wrote 60 plus pages, a guide called Navigating Access to Gender Affirming Hormone Therapy, which was to help. It was really a love letter to TGNCNB folks to help them access medications more safely, because we're finding some AI sites, some scam sites. Oh, perfect, Laura. Thank you so much. I just want to make sure we're not missing anybody's email. So perfect.
Oh,
Oh, the
I also
link.
wanted to
Oh, go
to
ahead.
add,
Yeah,
Taylor, about just harm reduction services. In Latin America, specifically South America, there are not a lot. I'm in Peru, and there's just like one organization that doesn't have like government funding or anything that's providing drug checking services. Their name is Proyecto Soma, or Soma Project. I'm not sure if in Chile there are other organizations, but I do know that there's a network of people that use drugs, so you can share. They usually share resources. It's called Red Lamput. I'm gonna write it in the chat. Red Lamput, which is the Latin America network of people that use drugs. So maybe you can, reach out to them. They have members all over Latin America, and they might know about services in Chile. Yeah.
perfect. Thank you so much. Yeah, and as I was saying early on, we're running our Las Americas series, which we have one more. If Laura, you can please do me a favor and put it in the chat. Um, that is an amazing harm reduction series focusing on our Latine, our Hispanos, everybody who is doing this work in the global South and beyond. So I just want to thank everybody so much, since we're right on time here. Thanks for joining us. As I said earlier, this will be recorded. There will be a follow-up email. Just be patient with us. But I appreciate you all, and you are what makes the world go round. Thank you so much.